Hey everybody, how's it going? I wanted to get on here and make a video that's going to give you an introduction to our class here. So this class is our class that we do as a comprehensive review is the name of the class. Now, if you've gotten this far, you've probably already been able to successfully register, and you've probably noticed that this class doesn't say Nuke Med. It doesn't say NUCM at the beginning. It actually says RADT 4942. It's not necessarily a radiology class, but in a lot of the specialties, they do the RADT 4942. It used to be called Transition to Practice. We call it the board's review, and it is a Nuke Med class. So if you got here, you're in the right place. If you know anybody that's been in the program with us and isn't signed up for this class, then they definitely need to be. But wanted to get on here and give you guys an introductory video. And again, summer semester's here. You've made it. You're so close. We got one last push, and we'll get you guys graduated and onto your boards and full Nuke Med Tech. So it's a super exciting time. But this semester is shortened compared to all of our other semesters, and there's a lot to do to get ready. So I wanted you to be able to get started right away, and so I'm doing this introductory video. We will meet for both quality assurance, which is the class I'm teaching you, as well as this one. Our first time we meet will be the 14th. But I wanted to let you guys have an opportunity to get started, and hopefully this video answers some questions that I'm already getting, and that'll be good. So what I'll do is I will share my screen and we'll look at Canvas. We'll go through the syllabus and we'll go through some of the projects and try to get you oriented to what is on Canvas and what you can get started on, and maybe try to prioritize what we should go for first, and then what can be saved to a little later in the class. So let me share my screen. I know. Have to forgive me because I got a little bit of some kind of cold going on right now, and my voice is a little hacky. All right. So hopefully I am sharing the right screen. It looks like I am. Okay. So again, this is comprehensive review RADT 4942. When you open up Canvas, this is what you'll see. Again, there will be the instruction video posted here. If you are watching this, then you obviously got to it, so congratulations. We're first going to go over the syllabus, then we're going to talk about our registry review, group projects and presentation that we're going to be doing this semester, and we'll kind of get into that, and then I'll show you kind of a guide on everything, but we'll spend a lot of this video on that because it's the stuff that you'll want to get started on sooner than later. So let's click into the syllabus. My computer's been being slow today. I'm not sure what's going on, if I have a bad connection or what. Okay, that came up pretty quick. Okay, all right, so this is nuclear medicine. Like I said, RADT 4942. Again, we call it comprehensive review, and this is for summer of 2026. I'm your instructor. Shauna tag teams this class with me, and so I've listed her on there as well. Again, you guys know by now, the best way to get me is to use messaging on Canvas. I'm going to go through the core assignments, and then we'll go over more of what they are, but this will kind of get you an idea. But the core assignments here, your number one thing you're going to have is you're going to have 6 examinations to work through. There's going to be 4 of those that are located in the Review of Nuclear Medicine Technology, Preparation for Certification Exams by Norman Bolus. That is a green text, white and green. I have it as the cover of this class. So if you are going into your Canvas and you're clicking on your classes and you click on this class, I literally put that book as the cover so you can see what it looks like. If you have any problems finding this, let me know. But it's a great book. It's a really good review book. It's what you're going to be using heavily for this class, along with, of course, all the previous texts that you have. But in that book, at the end of the book, there are, I believe, 8 exams. There are 100-question exams each. And what I'm going to have you do for this class, we don't have the time in this semester with everything we're doing to have you go through every one of these, but I'm going to have you go through the first 4 exams from that book. And then I'm going to encourage you to continue after you're done with this class and as you're preparing for boards to go through the rest of the exams in this book. It will be optional for you, but that would be my encouragement. We're going to take you through the first 4. The other 2 exams that you'll have are going to be 2 mock exams. And this is where a shout out to Shauna. She's created 2 mock exams. These mock exams have the same amount of questions that your boards have. And so they're intended to give you an opportunity to have a board type experience. Now, Shauna will be in contact with you to give you some more details on these and give you instruction. But essentially what we'll be doing is we'll be having you take one of those right away, and it's designed to be a experience where you kind of see where you are right at the beginning of the semester. You're going to have the opportunity to do test corrections for that exam, which is I've listed as number 2 here. So that if you really bomb it, it's okay. We're going to give you a chance to get those points back up. But also, again, as I've always told you guys, test corrections are an awesome way to make sure that what you do miss, you've learned from and you know for the next time because you've had to go and look it up. Okay. So test corrections, we'll have you do test corrections on that exam. And then the second mock exam you'll take at the end of the semester to kind of see and gauge where you've at and where you started from and where you're headed and what you still need before you actually go take the boards. Number 3, and this is the one that will be coming kind of up quick sooner than later, relatively quick, is the Nuclear Medicine Comprehensive Review Group Project. This is going to be a presentation, and then there's a study note component, and I will take you through the module on that here shortly to kind of give you an idea of what that's all about. Okay, so as far as our timeline goes for this class, this is the first week of May. Again, we're doing the introduction video here, and so just sometime during this week you can watch that. On May 14th, which is what is it, the 5th? Yeah, so just in 9 days, that's when we'll have a Zoom meeting. In that Zoom meeting, I'm going to review some of these things again. I'm going to answer questions on the group projects. I'm going to get you guys kind of set in stone and give you an opportunity to ask any questions, and we'll go over some of this stuff again and kind of get you guys started there. Now, I don't have a lecture per se that I'm going to do for this course, because a big portion of what we do is going to be on our on-campus meeting that we're going to have on June 4th and June 5th. So it's an on-campus meeting. Details about that meeting, things like parking, how to get there, what to do, you're going to get that information from Professor Clampett. So he'll have information, and he may have already shared that with you. If he doesn't, that will be shortcoming on that meeting. But we'll meet, and this is when we're going to have a registry review. Those 2 days, we're gonna look at the ARRT content specifications. This is when you guys will be doing your presentations and your group projects. Okay, so that will come then. So that's going to come sooner than later. And so I'm going to try to get you mostly with today's video and with our when we meet on the 14th, comfortable and ready and knowing what you're doing for those projects. Okay. And then after that, we may have some meetings. The way we've done this in the past, instead of being rigid, we're going to see how that campus meeting goes, and then we're going to schedule some additional. And you'll hear from both me and Shauna on kind of some dates and times, and we'll kind of play that by ear on what we feel like we need, what works for people, what people need to hear more about. Maybe we need to do. I've often done a review on physics and instrumentation because you guys did that the very first semester, and so we may do a class where we do that. I don't have things listed because we need to see what's needed, and then we'll kind of work for what you guys need, what the need is for the class. Okay, and so we'll figure some things out as we go along. But in that interim time, once we've done our group projects, we've met, then of course you'll want to finish the bolus exams 1 through 4. You can do 5 to 8 on your own. We'll get turned in test corrections, and we'll provide the opportunity to take the mock exam number 2 on Canvas. I also have some worksheets that I'll point out to you of a bunch of math stuff, and I put that out as extra credit. So I've put worksheets where there's math problems, and I've given you an answer key. And so I'm not necessarily looking to grade. I'm just looking to give you an opportunity to go through those and do those things on your own. And then I'll give you extra credit for what you do. So Grading, grade for this class is going to be based on a couple of different things. I'm going to give you 20 points for each bolus exam that you complete. So again, I'm offering you 1 through 4. So those will be worth 20 points each. And on those, there's not, because you have the test and in the same book, you literally have the answers. It's not something I grade, but something that is going to be up to you. If you want the experience of learning and preparing for your boards, then you're going to take those tests without looking at the answers. And then you're going to go look at those answers and learn from them. And so because there's not a way to grade that, I'm just giving you 20 points for each test that you do. And it's going to be on an honor system. You've got to get on there and say, hey, I did the test. I went through it. This is what I learned. I'm going to want to know your score and what you scored because I want to keep track of where you are individually as a student. And I want to see some progression as we go from test to test. That's what I'm going to be looking for. So I'll give you credit. Everybody gets the 20 points for doing it, but I'm going to want to know your score, and I'll show you where to hand that in to me. There'll be 400 available points for your content specification, presentation, and study notes. That's the group project. There'll be 200 points for each of the 2 mock board exams. And then, of course, a half a point for each test correction from exam 1. And then I'm going to give 10 points extra credit for each math worksheet that you complete. And I'll show you all of that information. Again, course materials is going to be our module on Canvas. And then, of course, the review book that I mentioned at the beginning, the Norman Bullis book. Okay, so that's the syllabus. Let's get into some of it so you can kind of see what these modules are, how to work through them, what the group projects are, and kind of what to expect. Since the group project is coming up quick, I want to go there first. But the first thing I'm going to share with you today is the ARRT content specifications. If you don't know what this is ARRT for all of the specialties that they do, including just radiography. They put out a content specifications for what to expect on their test. Now, this is not super detailed, but it gives you an idea of kind of the general things that will be on the test. What we've done in the program as we've gone along and as I've taught you, is I've tried to say, okay, for each of the classes that I teach you, I'm going to not teach you things that aren't on the boards. And this is how I know what's on the boards. Now, it's not super specific, but this is what we try to base program content on. So I'm going to kind of introduce you to this, and then I'll show you how we're going to use it. On your board exam, when you take it, there are 4 sections. There's patient care, safety, image production, and procedures. Okay. You'll notice, and I want to point this out right away, they show you how many questions you get from each section. Notice 118 questions. The vast majority of questions comes from procedures. That's your radionuclides and radiopharmaceuticals. That's your cardiac procedures, endocrine and oncology procedures, GI, and other imaging procedures, your bone, your HIDA. So all of the procedures we do, that is the vast majority of your questions are going to come from that. Then you've got 33 questions from image production. That's your instrumentation and physics stuff. Safety also gets into your physics, right? So radiation physics, radiobiology, regulations, that's all in safety. 25 questions there. And then patient care and interaction, 24 questions there. So this shows you how your test is broken up. Then the second half of the document is it going through and kind of giving you a bullet point list of what's on. So for example, since procedures is big, let's go down to procedures. So you see here's where patient care starts. Patient care continued. Safety. Safety continued. In fact, maybe I'll stop here at safety and we'll start right here. So if you look on safety, section 1, it'll say radiation physics and radiobiology and regulation. So what do I need to know of that general topic heading of safety? Well, it's going to list an A, B, C, and D. So it's going to start out principles of radiation physics, decay of radioactivity. What could be there? Well, atomic structure, decay modes. Remember when we learned about alpha, beta, gamma, decay rates, how to calculate the math. What's a half-life? How does half-life work? Can I calculate half-life? Half-life. Half-life. What's a parent-daughter relationship? How does that work? CT characteristics. Do I know what Bremsstrahlung and characteristic are? Do I know the interactions of radiation with matter like photoelectric effect, Compton, Rayleigh, pair production? So this shows you, again, and you can see where when we did physics instrumentation, this is where I got what I taught you right here. And so these are the things you're going to need to know. And that's how this is laid out. Now, when you get to procedures, and here's image production, survey meters, dose calibrators, scintillation systems, right? When you get to procedures, let's go down here. What you're going to notice is first it'll talk about radionuclides and radiopharmaceuticals, and that's going to be Shauna's radiopharmaceutical class that she taught you. So all that stuff's in here. What I wanted to show you is when they get to the procedures you do. For example, you'll notice, because we just did the cardiac class, so this will be right in your brain. Remember what did we go over in our cardiac class? We did gated blood pool. We did myocardial perfusion, both SPECT and PET. We did viability and we did amyloid imaging, right? And the reason I taught you that is because that's what you're going to be tested on in the boards. I mentioned in cardiology class, there's a few other things we do like in cardiology, like inflammation scans and some other things. We didn't lecture on those because they're not on your boards and you need to know what's on the board. So this is where you can get that information. Now, what I want you to notice here, when you look at cardiac procedures or endocrine or anything, what it does is it then shows you the focus of the questions. So take, for example, if we were doing myocardial perfusion, then you come over here, A is going to say, what's the instrumentation? How do we use our gamma camera? What's the detector system? How does data acquisition look? What are the radiopharmaceutical we use for that? What's the dosage? How's it administered? How does biodistribution of that pharmaceutical happen? What's the patient education, preparation, and monitoring that we do? What are any restrictions or adverse reactions? What's the imaging techniques? What's the anatomy and pathophysiology that you could expect to see? And what's any standards, right? So when you are looking at it, these different procedures that we do, this is the kind of questions they're going to ask you about those procedures, right? And so that's how you read this document. And that shows you for all the procedures. If you go down, it starts with the cardiac, then it does endocrine. And as it gets down here, you've got GI. So you've got your gastric emptying, your HIDA, your GI bleed, your Meckel's, your GI or GI reflux study, renals. There's your renals. Bone. Here's your bone scans, your infection scans, CNS, lung. So all of that stuff here's your focus of your questions. Okay. So the reason I wanted to show you this, and then it lists all the common radiopharmaceuticals used in nuclear medicine, which is really cool. So these obviously need to know these radiopharmaceuticals, right? We need to know what we use to do all these procedures. So the reason I show you this document is because for our group projects, this is kind of your Bible. When I give you it, you're all going to be assigned sections of this to learn and to study. And this is where you go to get what you want to have in these presentations, okay? So now that you kind of have that as a background, let's go to the module of what the presentation is and what to expect and kind of explain it. But now that you have that background, you'll know what I'm talking about here. Okay, so I'm going to go into under Register Review Notes and Presentation, the Nuclear Medicine Board Review Group Project, okay? And then we'll look at the assignments for those projects. So I'm doing a different version of this year with you guys. I'm trying to improve this, make this better as we go along, and make it something that functions in a way that you get the most out of it. So I used to take a section of the comprehensive or the ARRT content specifications, and I would just give you your own section, and I used to ask you to do a PowerPoint and present on that. And what we found over time in class is that it was good to review. It's effective in that way, but it ended up that everybody got up and did a lecture, and it got a little bit dry and boring and not a lot of class interaction. So this year we're going to change it up a little bit and try to help you to get a little more interaction with doing this in a group style project. And I think it will be a lot more fun, and I think we'll have a good time with it. So we're calling this the Nuclear Medicine Comprehensive Review Group Project. Purpose of this assignment is to comprehensively review nuclear medicine board content in a way that's engaging, collaborative, and clinically relevant. By the end of this project, each student should feel confident in discussing and teaching key concepts likely to appear on the board exams. Additionally, each group will contribute to a class-wide board-reviewed study guide that will be shared with all students. So I'm going to go over the components of this. Group structure and expectations. So students are going to be divided into groups with 3 or 4 members. I think I was able to get 4 people in every group except for one because of how the numbers worked out. Each group is going to be assigned 3 topics from the ARRT content specifications, and all members are expected to contribute to this group project. Each student should be able to explain all the answers, teach the material, and lead a discussion. So I put this right here. What I want you guys to do is I want you to take your section from the content specifications, and I want you to treat it as though you're going to have to be an instructor. Believe it or not, this has purposes. It's not just to make you get up and feel stupid in front of people and be scared. There's levels of learning. One level of learning is where you grab some information and you read it and you learn it and you're like, okay, I have that. There's another level where you get a concept and you really have to maybe explain it to someone else. And then there's a whole nother level where you need to prepare to be a teacher of something, okay? And when you go that deep to be able to teach a topic to other people, it's in your brain and it's locked and it's there and it's a great learning tool. So what I want you to do is the topics that you'll be assigned, I want you to become the expert on the topic. I want it so that if someone has a question, they could raise their hand and say, well, what about this? And you've studied it through, so you know the answer, okay? And my hope is that as each of you take one of those sections and have this experience where you really are able to deep dive in and get something really ingrained in your brain, that you'll then realize and take that to the rest of what you do on the boards. As you study for your boards, you'll be like, I know how to deep dive into all these topics. I know how to identify by taking test after test after test that you'll do. I know how to identify where my weak points are, and now I know what to go in and study as though I was going to have to teach it. That's the purpose of this, is to get you really in deep into a topic. So you want to become the expert on your topic. So there's a couple of components here. Now, first is the presentation component. This is going to have a quiz portion and a teaching portion. So groups will present selected topics during an in-person board review session. So the 2 days that we meet, we're going to be presenting these topics to the class. So each group should prepare a PowerPoint style presentation on each assigned topic. So remember, your group's going to have 3 topics. I want you guys to prepare a PowerPoint style presentation for each one of those topics. This is not going to be handed in. I'm not interested in judging your PowerPoint of how fancy it is or anything else. As long as we can all see the information, it's viewable, it's a teaching tool for you to be able to teach, okay? So you're going to make that PowerPoint. It can be PowerPoint, or you could even have a PDF that we show, and that's just going to be brought like on a thumb drive that we'll plug into the computer in the class, okay? So what you want to do is I want you to be prepared to teach and discuss your topic. However, I'm not going to simply just ask you to teach. Here's the second kind of component of this. You'll notice that I said quiz and teaching discussion. What I would like you to do is your topics, after you've studied through them and you've discussed with your group, I want you to come up with and create 10 multiple choice board style questions to present to the class, okay? So this will be fun, because what you're going to do to start your presentation is you're going to get up and we're going to start with the quiz of your section. And you guys are going to quiz the class. So we're going to see what we know. So you're going to take your 10 questions, you're going to have the answers, and you're going to throw those up on your PowerPoint or on your PDF. And we're going to test the knowledge of the class. We're just going to see what we know. We're going to see, what do we know about that topic? And what my hope is that will then naturally lead into you having the opportunity then, as questions come up and as we try to answer these, to teach. And if you have a PowerPoint presentation ready to go, you'll be able to then go right into some teaching points. And again, as you can imagine, each of you will have 3 topics, and the board's review is a long time. And so I want each of these quiz and teaching sections to only last about 10 minutes. So not a huge amount of time. So we go through these 10 multiple choice questions. We see what the class knows. We answer questions. You'll have us as instructors there to help with answering questions as well. And we'll see, what do we know and where are we at and what do we do, and let's review this, right? And you guys will be responsible to lead that discussion and be the teachers of that topic, and have a slides that you may or may not use. You might we might get into some questions about a bone scan or about a HIDA, and you'll be like, well, let's look at a couple pictures, or let's look at the information that we've compiled as we've prepared for our teaching experience. So that's what I want you to do. You're going to come up with 10 multiple choice board style questions and have a PowerPoint that's ready to be able to teach from if necessary. And we're going to quiz the class, and we're going to see what we know, and we're going to learn from each other and have a discussion on each of these topics. Okay, so that's what you're going to need to do. The other component to this, so that's kind of component one, which is the quiz and the teaching. And then component two of this is that for each assigned topic, I would like your group to create a concise set of notes that will be used to build a class-wide board review note bank. So the expectations on this is that whatever you are studying, I want you to make a guide. And the way I want you to think about this is, if I were going to go in and take my boards and I just wanted bullet point things that I could review quickly before I went through of the different topics, that's what we're looking for. So format expectations I put here, prioritize bullet point style over paragraphs. You know, the simple bullet points of things you need to know. Be clear, be organized, and easy to understand. 1 to 2 pages per topic. That's all we're looking for. The quick, easy facts about whatever scan or whatever topic you have. Okay, so concise but complete. Content should include, when applicable, things like any key definitions or core concept, radiopharmaceuticals and dosages, patient preparation, any imaging protocols, normal versus abnormal findings, relevant anatomy and physiology, common pathologies, any pitfalls, artifacts, weird things that are kind of known to happen with some of the exams, contraindications, any important calculations or formulas that you would need to know, things like that. So notice these are very similar to what they list on the content specifications when they tell you, okay, here's the stuff you need to know about these exams, right? So that's kind of where I got a lot of this information. So important guidelines, just again, think, what would I want for a last minute study before boards? Avoid copying directly from textbooks or slides. Just come up with some bullet points on your own of the things you actually dove into and studied. Use your own wording, but make it simple. And then again, prioritize clarity and relevance over volume. We don't want paragraphs of stuff. We want simple, easy to understand notes. What you'll do is you'll turn in that note for your group, and then I will take that and I will make a section on Canvas where we can go and access all of the points and all of the notes that people have made for the entire board, so that you're making notes for your sections, but you're going to have notes available from these presentations for the entire content specifications that we'll go over. So I hope that can be a valuable resource that you help each other to have as a study guide for boards, and a simple, easy to look at. So that's kind of our two things we'll do on the 4th and the 5th when we meet. So that's why I brought this to you first, because the 4th and the 5th are going to come quickly. Okay, and so let me go down here and I'll kind of show you what to turn in. So what do we turn in? For each topic, you're going to submit your board review notes document. And so what I'm going to do is I'm going to provide a place on each of your Canvas so you can submit your document. Now, obviously, you're going to have a document, your own document for each of your sections, and you'll all hand that in. And I will grade yours as an individual, but I will only use one of your group documents to put on the board. So I'm assuming you'll all have the same document, but if you all hand it in, that's just an easy way for me to grade you as an individual. Again, you're all going to get the same grade on it because you're doing it as a group. But again, this just kind of goes over what we want out of that again. And then grading criteria for all of this. The first thing I'll grade you on is the questions. Like, did you think through and come up with some good questions? You know, did you think through quality and depth? Does it help us kind of learn as a class? The other one will be content and coverage and accuracy of the information you guys present. Presentation, teaching, and effectiveness, I'll do a 15%. Professionalism and group contribution 5%, and then your notes that you give will be 30%. As you guys know about me, I'm not a hardcore stickler teacher that's just judging everything you do. I want you guys to feel comfortable when we do this. This is low pressure. We're all in it together. No one's judging anybody. If you go through all these things and you show up with a presentation and you get up there in front of us and we teach and we learn together, then I'm going to give you the credit you deserve for these things. So don't stress about every little detail of the grading, but do the assignment. Get the assignment done. Learn from this. Again, this is something I've designed, and this has been here, at least in a form of this, has been here even since I was a student. And this is a valuable thing to get together and review. And you're going to feel like, man, I mean, maybe you're already feeling that way. Like, I don't know if I'm ready for boards coming up after just this semester, but this will help you to kind of get a big overview of everything. And you're going to feel a lot better after we meet on the 4th and 5th. So that's our goal. Okay. So that explains that project. The other thing I need to show you is just where your group assignments are. And I'll say on the onset, there's just never a perfect way to assign groups. And I realize that, and I realize not all of you live in the same areas. And because I don't know where everybody is, and some people are together and some people aren't, I put you in groups that are just spread. And what you'll have to do is just get with each other on emails and Zooms and things like that and talk to each other and plan out what you want to do. There just wasn't a super easy, I've tried to do it the most fair way we possibly could do it. And I did it random. I did kind of a random generator and did it that way. If you have a major problem with your group assignment, let me know. I'll tell you that you guys know I'm not a super stickler about things, but I probably will be somewhat of a stickler on this because as soon as I start moving one person, it turns into chaos. And so talk to me if there's an issue, but we'll try to stick with these as much as I can. I know that there's extenuating circumstances that come up, and you guys know that I'm workable, but we'll do the best we can. So if you open up this document, this is the comprehensive review group project assignments. So I've listed, there's 10 groups here, group 1 through group 10. And what I've done is I've listed first the members of that group, and then I've given you the sections that you're responsible for. So then this is listed exactly as it is on the ARRT content specification. So for example, this first group is going to have safety, and they're going to have 1A, which is radiation physics. So everything under 1A. They're going to have procedures 1A and B, and then they're going to have procedures 2B, which is myocardial perfusion. And so you'll go to the content specifications document, and that's where you'll see what you have to cover, and it will give you all the information of things you need to cover. Okay. These need to be separate PowerPoints. These may not be done in order. I won't call up group 1 and have you do all 3 of your presentations. We'll follow the order of the ARRT content specifications. And so you won't be doing these in order, and you'll need to have a separate PowerPoint for each one of these, and then a separate note document for each one of these, so that when I go to compile these all back together, I can place them in an order separately. Okay, so that's how you'll look at that. So all the groups are listed here. If you don't see your name here, please get with me quickly. I took them right off of Canvas and who was registered for the course. I have had once in a while where somehow someone didn't get registered and I missed them or something. And so if you don't see yourself on here, please just get with me soon. Again, group 10, it just ended up that there was only 3 members of that group. And so I have a spot that we can add on anybody that might be straggling. And again, I put a note on here. Your topics are intentionally mixed across categories to reflect the structure of ARRT exam. You're responsible for mastering all the assigned areas that you have. Okay. All right. So that's kind of imminent stuff that needs to be done sooner than later. And so hopefully, again, if you have any questions, let me know, but that's something you can look on. And again, I'm going to go over this again on the 14th, and we're going to talk with each other because I'll have you guys present. We'll ask questions. Mock board exam 1 is up here. I'm going to refer to Shauna. She'll give you some information on expectations for that. This is where I've listed my math worksheet. So if you click in here, it will pull up a document that has several pages of worksheets. And for some reason, there it goes. And I think I have, what is it? That's not, oh, here we go. Got pages, that's why. So So I've got 10 worksheets in here. So for every worksheet you do, you'll get extra credit for each worksheet. So there's the worksheets there. And then I have the answer guide also under that same module. So there's a review, a key worksheet. So that worksheet key has the answers to all the questions, so you can look those up. Again, I didn't know a great way to do it. So again, it does you no good if you do the work, just look at my answers, right? This is for your benefit. So if you're doing the extra credit, make it worth something for yourself. I put the key up there so you could work through those problems and you could see the answers and then let me know. All right. I think that's all I want to cover right now. That'll at least kind of get you started. We'll talk a little bit more when we meet, but that should get you going. Please let me know if you have any questions, and I will see you guys on the 14th, and we'll get into it even more.